Là, nous avons l'autre spécialiste en médecine qui ensemble avec nous-mêmes et nous allons présenter avec nous-mêmes et il va dire qui est-ce que l'IA et qui ça que nous va parler jeudi à là, parce que nous connaissons ces périodes de fêtes, de festivités, holidays, qui ça pour doit faire, qui ça ou pas doit faire. It's a real pleasure, again, to have you, Dr. Sanchez, to share this program television. Last time we had you in a press conference with Equity Now and Beyond.
Yeah, that's correct. Yeah.
Exactly. But today we have you with the Haitian audience, the Haitian community, again to talk about the do's and don'ts regarding the holidays. But before we do that, can you tell our community who you are and what you do at this point so that we will know, and I will do the interpretation in Haitian Creole and teach you a few words.
That sounds great. Good morning, everyone. I'm Dr. Sarimer Sanchez. I'm an infectious disease clinician. I'm a doctor, and I also work for the Boston Public Health Commission as a medical director for infectious disease.
Moi, c'est Dr. Sarimer Sanchez. Moi, c'est un docteur en médecine et c'est moi qui directeur responsable de département maladies infectieuses pour Boston Commission publique. C'est là que moi travaille ensemble avec eux-mêmes. Là, moi content pour moi ensemble avec eux-mêmes. Now you tell us who you are, what you do. You're working with the Boston Public Health Commission around infectious diseases. And what is your day-to-day operation in terms of, you can tell us?
Well, my day-to-day can look very different. Days like this where I get to have the privilege of being here in our communities and talking to sort of our residents about communicable diseases such as COVID and flu and providing education and trying to really overcome a lot of the inequities that many of our communities that have been most impacted face.
Again, demandez comment que travaille chaque jour, comment ça y est, dit, il est capable de changer, il est varié, il est bien content jeudi à là, pour avec résident dans la communauté, pour capable de partager une série de maladies qui communiquent aussi facile, COVID-19 et parler de flou aussi, pour capable de faire ça, et son plaisir pour capable de communiquer avec nous-mêmes et expliquer nous comment nous capable de continuer, prendre précaution sur question de maladie ça. Now, come up. Now, let's talk about the do's. This is the holiday season. People say it's a party time, or some people it's a reflection time. Some people said, I just don't know. What should I do? Because we are still in a pandemic season, and flu season. COVID is not out yet. So what can you tell us?
So we are seeing a lot of flu in the city. We're seeing rapid rises of flu cases, and we're also seeing rapid rise in cases of COVID-19 as well. So I think there are a few important do's. Translator, should I?
Good, yeah. So, nous avons un pile augmentation de contamination avec maladie grippe, ça, que nous avons les flois, et nous avons un pile augmentation de maladie de COVID-19, là, que nous avons ici. Et puis, un peu bagay que nous sommes capables de faire.
All right. And we're also seeing our flu hospitalizations rise across the city. So the big do's are get vaccinated. So everyone should get their annual flu shot, and everyone should get their booster if they haven't for COVID-19. They were just approved for even young babies 6 months and older.
So, nous avons un pile augmentation de cas d'hospitalisation de flou dans l'hôpital nous yo. Eh bien, pi gros bagay pour nous capable faire, c'est pour nous capable vacciner. Si nous ne pouvons pas vacciner, nous devons vacciner. Et puis, il faut être capable de prendre vaccin pour grippe là, vaccin flu. Chaque année, nous devons prendre. Troisièmement, il faut qu'on ait que vaccin pour booster COVID là, li déjà éligible et disponible pour enfants, petits moun qui gagnent l'âge de 6 mois. You said 6 months?
Yes, and that's also for flu. Everyone 6 months and older can also get a flu vaccine.
Wow. So, quel que soit ti moun nan de 6 mois et plus, li capable prend yon vaccin pour flu et puis vaccin pour COVID. So, meaning that the do's, get vaccinated, pour vacciner, just get boosted, okay? And even the children needs to get vaccinated as well.
Yes. The vaccine really protects children and adults from getting sick and being in the hospital. And we see a lot of children that can get sick, especially from flu. And we see our hospital rates rising among children from flu.
Nous voyons que le taux d'hospitalisation pour Timounio continue à augmenter et nous avons encouragé pour capable vacciner Timounio contre grippe là qui a fait ravage. Then I just got a question while we're talking about the children. Many parents are afraid, especially Haitian parents, are afraid to get their children vaccinated, saying or thinking that the children will somehow be impacted cognitively by having the COVID-19 vaccine. What can you say?
No, it's a very common concern that we hear, and obviously parents really want the best for their children. There have been no associations between the COVID-19 vaccines and flu vaccines in any cognitive challenges. So I just want to make that very clear that there's no association that we've seen.
So, Dr Sanchez fait nous connaît que pas gain association avec question de li ka bay ti moun nan problème, li pas capable apprendre, li ka affecter développement éducationnel académique li ou bien à impacter cerveau ti moun za, il fait connaît que pas aucune association du tout que vaccin Covid, que vaccin flu, pas gain ça du tout. Now, we have many people who got vaccinated and got COVID. So, how can you explain that to them? Say, well, the fact that I know if I am vaccinated, I should not be impacted by COVID. How can you answer that question?
I think the biggest protection that the vaccines offer us is from landing in the hospital and from needing a breathing tube, needing oxygen, or even dying. So I think both the COVID-19 and flu vaccines, they're not perfect. We might get COVID-19 and flu, but we're going to be able to recover and stay at home and recover in a few days. So that's really important.
L'important pour nous essayer de comprendre, c'est que bénéfice vaccin, vraiment vrai, c'est pour capable aider premièrement pour pas à l'hôpital, deuxièmement pour pas gagner un tube pour respirer, pour entrer dans le respiratoire, et puis troisièmement ou bien pour pas mourir. Ni vaccin Covid là, ni vaccin flu a aider au combattre aspect ça yo, ou pas tomber dans l'hôpital et la protéger parce que c'est très important pour nous essayer de comprendre, c'est ça que vaccin fait pour nous-mêmes. Now, talking about long COVID. I just got a friend of mine who said, well, since I have COVID, I have no smell. I cannot smell anything. Again, what are the symptoms basically that's long COVID and how to deal with that?
Yeah, long COVID, we're still learning a lot about long COVID. Long COVID is when sort of symptoms last, especially if they last more than 6 months after the initial infection. And they can be a few key ones: shortness of breath, ongoing chest pain. A lot of people have memory and sort of some memory issues, fogginess, and some other kind of neurological symptoms. So it can look like a lot of different things. Fatigue is one of the most common as well.
Nous connaissons que un pile monde qui gagne COVID, yo continuer subir une série de problèmes après que fin gagne COVID là, on capable fatigué en pile, on capable pas capable respirer rapide, c'est tout le temps souffle coûte. So tout aspect ça et nous continuons à pas prendre davantage concernant long COVID parce que les causé après même qu'on que fin COVID. Now there's a treatment basically that can help with long COVID.
Yes. Well, so the treatments for long COVID are still under investigation, but there are doctors across the city that help patients with long COVID manage their symptoms. Yes.
Thank you. So, est-ce que il y a un traitement pour question de long COVID là? Il fait qu'on est toujours à la recherche, il a continué à investiguer quel type de traitement, mais il y a un docteur qui est capable de prescrire quelques médicaments qui a aidé à faire face avec la question de long COVID là, parce qu'on prend et continuer de demeurer sur eux-mêmes. Now, we talk about the do's for the holiday seasons.
Yes.
And what are the don'ts?
Well, there's a few more do's if I could add.
Go ahead.
There's a few more do's that are really important. And actually, one of them that we just talked about. So The other one I would say is, do get tested, especially if you're having symptoms of a cold or any, fever, cough. So that's one of the all the do's. And if you are feeling sick, stay home and avoid seeing others.
Attendez, il y a un autre bagage qu'on doit faire, c'est ça qu'on a parlé, ou capable de prendre un test, et il y a un test disponible qu'on y a là, gratis, ou pas payer pour ça. Et puis, l'autre bagage qui gagne, dit, ou capable de pas arrêter dans mi-temps moun sous senti ou tester positif, et il aussi encourager nous, sous malade, rester la caillou pour capable pas infecter l'autre monde. Mais vous sentez ou grippé, essayez normalement prendre un test.
Yeah.
Nowadays, the test, COVID-19 test readily available, so that's not a problem.
So we have a few free walk-in clinics that the city of Boston. They are no insurance or ID is required. We see patients of all ages for both COVID-19 tests as well as COVID-19 vaccines and flu. So yes,
Stop right there, because
Yes.
people told me that sometimes when they go to get the flu shot, they ask them for insurance, and those people, on the verge saying, well, should I go? Should I go? So you're saying that you do have the Boston Public Health Commission has a few walk-in clinics where people can go. Oh, let me say that in Haitian Creole. So, gagnons pile, yo déjà placé pour nous-mêmes, une série de sites pour que vous capable prendre vaccin. Ni vaccin COVID-19 là, ni vaccin flu pour grippe là, ou pas besoin by aucune assurance. Vous entendez? Et ou pas besoin by identification, n'est que aller, et puis il y a pas mesure pour capable ou vaccin. Even tested as well at some of the centers
yes,
offer
we
that?
have COVID-19 testing. Yes, PCR
And it's
testing.
all free?
Yes,
you don't have to
it
pay
is
anything?
free.
And no
Yeah.
insurance?
No insurance, no ID.
Attendez? So, tout bagay sa yo, wap vacciner, wap pour COVID-19, wap vacciner pour flu, et puis yap testé pour flu gratis, ou pa gen 5 kob ko wap paye, et so c'est de clinique qui ouvri pour vous-même. Are those clinics open every day?
So I have the hours that each of the clinics are open.
Yeah.
So we have 4 sites that are open. The BCYF Hyde Park at 1179 River Street. That's open Tuesdays from 12 to 8 p.m.
So nous gagnons au bureau, nous gagnons un site là qui ouvri dans communauté centre communautaire qui dans Hyde Park là, qui dans 1179 River Street, qui ouvri de mardi Tuesday and until Saturday.
12 to 8 p.m. No, that one's Tuesdays 12 to 8 and Thursdays 7 a.m. to 3 p.m.
OK, so mardi 12h pour 8h, midi pour 8h, et puis jeudi encore midi pour 8h dans Hyde Park.
Correct. And then we also have the Bruce Bowling Building in Roxbury. That's open Tuesday, Saturdays from 12 to 8 p.m.
Tuesday and Saturday.
Through Saturday. So Tuesday,
to
Wednesday, Thursday.
Oh.
Yeah.
Et yon gon l'autre qui ouvri dans gros building qui est le Bruce Bowling là, qui est dans Roxbury là, qui ouvri de mardi jusqu'à samedi, depuis midi jusqu'à 8h, où on doit aller.
Yeah. And then we also have the Lena Park Community Development Corporation. That's in Dorchester. And that's open Sundays, Mondays, Wednesdays, and Fridays. Different hours, but they're open many days.
Et n'a faut qu'on ait une qui dans Lena Park là, qui dans Dorchester, qui ouvri depuis dimanche. Il y a différentes heures, mais on capable aller dans bagay ça.
Yeah. And then finally, the Josephine Florentino Community Center in Alston is Sundays from 12 to 4 and Mondays through Wednesdays 9 to 3 and Thursdays from 5 to 9.
So, il y a Josephine qui ouvri dans Alston. C'est bon dans Alston. C'est aller, what's the address of the Alston one?
123 Antwerp Street.
123, yeah. 123 Antwerp Street, c'est là que yo yé, et yo ouvri de lundi midi, lundi 3h, 4, 7h, yo gen différentes heures. So, yo gen 4 centres dans Boston qui ouvri, Lena Park dans habitué avec Dorchester, c'est Community Center qui dans Hyde Park là, 1179 River Street, et puis yo gen Bruce Bowling Building qui dans Roxbury, pour capable aller là, prendre vaccin. Booster available as well?
Mm-hmm.
Okay.
All the boosters, all the COVID-19 and flu
COVID-19,
vaccines. Yeah.
flu vaccine, no insurance. So, pas besoin de aucune carte identification, pas besoin de assurance, ou va permettre qu'on ait accès avec vaccin, avec booster, et puis non seulement pour vaccin pour COVID-19, mais aussi vaccin pour flu vaccin. Alors, tout bagage ça est gratis que vous mettez disponible pour capable servir toute communauté qui là. Well, so grateful for you just to bring this valuable information to my community, the Haitian community, because this is a show for the Haitian community in Haitian Creole. So then we cover a lot of do's. What are the don'ts?
One more final do. If you do get sick, well, two more do's. First of all, if you do get sick and you have symptoms of a cold, a fever, cough, and especially if you're older or you believe you might be at risk for severe disease, call your doctor. There's treatments for both flu and COVID-19 that can be life-saving.
Bon, l'autre bagay qu'on t'a aimé faire, sous senti ou malade, spécialement sous senti situation santé ou réellement à bail problème, relais docteur. Et docteur a gagné médicaments pour vous-même, ni pour flu, ni pour COVID-19 là, cela encourage pour les docteurs.
And then the other final do is, if you really want to protect yourself from getting sick this season, masks still really can help. They can help protect you from getting COVID-19, flu, RSV. So I would say, especially if you're older or you're at higher risk for these diseases, I would continue to wear a mask. The other thing I would say is if you're feeling sick and you can't stay at home and you need to be around others, wear a mask as well.
So, l'autre bagay que m'ta, dernière recommandation que m'ta aimé faire nous connaître, c'est que il est nécessaire. Si senti ou pas senti ou bien, ou pas vle rete bon côté moun ou bien, si senti santé ou réellement bay quelques problèmes, là, eh bien, toujours continuer mettez masque non, ouais, mettez masque moyen, parce que masque avec lui-même, il est nécessaire pour capable mettre masque là, parce que masque là a protégé. Et si senti que ou pas arrêter en dedans car là, ou pas senti ou bien, mais on prend le mi-temps et on full, eh bien, mettez masque parce que masque là continuer et protéger. So there are really benefits from wearing those masks.
There are. I mean, definitely, again, especially if you want to keep yourself from getting sick, enjoy the holidays with your family. Or again, if you're sick and need to be around others, it's a good idea to wear them.
En pile bénéfice pour gagner masque là, sous sens pas porter bien, alors nécessaire pour mettre masque, nous recommandons ça. Très important. L'église nous recommandons qu'on mette masque pour capable faire ça. We finally get the don't.
Well, again, I think the don'ts, let's think about the don'ts. I would say one of the don'ts is, again, if you're feeling sick, try not to be around others if you can. I think that if you have any symptoms of a cold, really try to stay at home. Don't go to work or school. Maybe that's the first one.
Exactly. And don't say that the vaccine doesn't work, doesn't help.
I'll go to that second one. Yeah. And then that's the other thing. I would say, don't, so that's the first one. Don't go to school or work if you're feeling sick. Try to stay home.
Okay. So, si vous êtes malade, rete travail là, pas le travail, par l'école aussi, rete de ça, et puis pas dit que vaccin pas qu'à aider. Vaccin réellement aider. Alors, c'est conseil ça que nous devons porter pour vous-même jeudi. Dr. Sanchez, we are so grateful just to have you with us. Again, a last word for our community?
Well, the other thing I wanted to mention is we also have another vaccine clinic at the BCYF Gallivan Community Center here in Mattapan, and that's this Monday, December 19th from 4:30 p.m. to 7:30 p.m. So that we're also going to be offering COVID, flu, and all the boosters. Okay.
Good. So, dans centre communautaire qui est dans Gallivan Boulevard là, il y a pour ouvrir lundi qui c'est 19 depuis midi et il faut qu'on ait que dans centre ça, gagner non seulement COVID-19, gagner flu vaccine et puis gagner test aussi que au capable prendre lorsque vous visitez centre ça. So you're telling me that those centers are open and no appointments are required. Is that true?
No appointments are required.
So, nous essayons de comprendre ça. Il est réellement disponible pour nous-mêmes. Ce n'est que aller prendre vaccin, ou pas besoin de payer 5 cop, ou pas besoin de assurance, et ou pas besoin de mettre rendez-vous. Ce n'est que aller dans le local que nous baillons, voilà, et sous tablier. What about someone didn't know all the different locations and where they could readily have access to those locations?
Well, it would be our boston.gov website and would have all the information on the ones that are open.
I'm glad you say that. Okay.
Yeah.
So, si vous parlez songer tout bagay ça, ce n'est que aller directement dans site internet da Boston Public right?
Boston Public Health Commission.
Boston Public Health Commission. OK? Ou ap genye toute adresse yo et tout horaire yo qu'il a. Alors, c'est ça que pour capable faire ça pour nous-mêmes, Programme télévision ça vient joindre nous pour capable aider ou comprendre nécessité pour être en bonne santé. C'est ça que nous fait là pour être en bonne santé. Et Dr Sanchez qui travaille avec question de maladies infectieuses pour Boston Public Health Commission, il vient pour capable aider ou comprendre comment pour passer une bonne saison de fête pour pas gagner tête chargée. Again, so my hats off just to you for taking the time out of a busy schedule just to be with us this afternoon and to convey the greatest valuable information to my community.
Of
I'm so
course.
grateful to you.
Of course.
For all your assistance, and especially not only to Trident Center, my organization, and HAU and IFC, but also through all the other coalition members, Alpha Agencia, Brazilian Women's Group, Center to Support Immigrant Organizing, CSIO, as well as ASEDON, African Economic Development Corporation. We are so grateful for all your support, ongoing support, basically, because we are in it together.
No, it is an honor to be here, and we thank you for all of your work, with our communities. And so, again, thank you.
Thank you so much, Dr. Sanchez.